Aerophobia, fear of flying. Aerophobia is an extreme fear of flying in an airplane. People with aerophobia may be scared about different aspects of flying, such as takeoff, landing, or getting locked in the plane. You might know that your fear is irrational. Statistics show that air travel has the lowest death rates among other forms of transportation, but you can't reason your way out of the anxiety. Another name for this condition is aviophobia. Most people with aerophobia aren't actually afraid of the plane crashing. Instead, you might fear the overwhelming anxiety that comes with being on the plane. The anticipation of flying, or thinking about flying, is often as troubling as being on the flight itself. What causes aerophobia? Aerophobia usually doesn't have a specific cause. It's very rare for aerophobia to stem from a traumatic experience on a flight. Specific triggers might include news stories about terrorism, crashes or violence on airplanes, takeoff and landing, thoughts about fire or illness spreading through the plane, turbulence, bumps during the flight. Other phobias can also make aerophobia worse: acrophobia, fear of heights; agoraphobia, fear of leaving the house or not being able to escape from a place or get help if something goes wrong; anthropophobia, fear of people; claustrophobia, fear of crowded, confined spaces; mysophobia, germophobia, or fear of germs. What are the symptoms of aerophobia? If you have aerophobia, you might avoid flying at all costs. It's also possible for people with aerophobia to have panic attacks before or during a flight. Symptoms may include chills, dizziness and lightheadedness, excessive sweating, hyperhidrosis, heart palpitations, nausea, shortness of breath, dyspnea, trembling or shaking. How is aerophobia diagnosed? There isn't a specific diagnostic test for aerophobia. Your healthcare provider will carefully review your symptoms and ask you a variety of questions about your fear of flying. Your healthcare provider may diagnose you with a specific phobic disorder, such as aerophobia, if you develop symptoms at the thought of the fearful object or situation, such as airplanes or air travel. Experience your fear for 6 months or longer. How is aerophobia managed or treated? Many people can work on overcoming their fear of flying with psychotherapy. Your healthcare provider may recommend cognitive behavioral therapy, CBT. CBT focuses on helping you change the way you think about flying. It might include learning about how planes work, or reviewing safety statistics for air travel versus other forms of travel. Your therapist can also teach you techniques to manage certain triggers. For example, deep breathing or meditation during takeoff, landing, or turbulence can reduce your symptoms of anxiety. You can also learn to talk back to negative thoughts about flying when they arise. Exposure therapy. This type of therapy gradually exposes you to places, thoughts, or situations that relate to air travel. You may visit an airport and watch planes arrive and depart. Virtual reality tools, such as computer simulations of flights, can also help you overcome your fear of flying. Is there a way to prevent aerophobia? There isn't a way to prevent aerophobia. But you can reduce its effects on your life by avoiding things that can make anxiety worse, such as caffeine, drugs, or alcohol. Sharing your fears and anxieties with a support system of family members, friends, or peers. Talking to your healthcare provider about your concerns.